So my name is Andrea Manzo. I'm a manager for Salinas Building Healthy Communities. Tony has made it a little bit easier. I think he started a really good introduction, and I thought I was going to shock people, but I think Tony did the favor for me. So just to give a little bit of a quick facts about what Salinas is or where I'm coming from. We are about 160,000 people, give or take. We have a large undocumented population, and so that they obviously aren't counted in the census. And we sit in the middle of an $8 to $10 billion agricultural industry that 70% of its lettuce feeds the world. And so it's a very profitable industry, yet we are facing a lot of challenges locally. So I'd like to start my piece by, as Tony mentioned, really centering the legacy of racism in this country, and particularly the damage that institutional and structural racism have had in the communities of color, such as Salinas. We have begun the process of dismantling structural racism within the city of Salinas through our Healing Informed Governing for Racial Equity work, which is now expanding to the county. Often when we think about community health, we isolate that analysis with the health department because we believe that's the place that should have the most impact on people's health. The reality is that it is across institutions and policies, as we watched in the Tale of Two Cities zip code video. This is why we lead with structural racism. If not, we're perpetuating the systems that are in place that are preventing our communities of color from having a better quality of life. I'll be talking about the role that power building, healing-informed practices, changing the narrative, and cross-sector collaboration play in improving the health of communities that have historically been plagued by structural racism. We know that power concedes nothing without power. And we know that it is the people that are in power that often design the institutions that have negative impacts in our communities of color. That is to say, the way that the system was designed did not come from nature. It was designed by most likely white men with their lived experiences bleeding through their work. It was not designed by people of color, nor does it reflect their experiences, their culture, their language. So the only way that those systems, the only way to change those systems is to acquire the power necessary and that to have equal or greater power to those that designed it and change it. So in our power building work, we have made sure to ground it in a set of core shared values and principles, making sure to have a healing-informed approach and an emphasis on capacity building. It is important to have a shared language on how we want to approach the work, and that's why it's really valuable to have a set of core shared values and to have that agreement of what is necessary to build resident power. And to ensure that our bottom line is the preservation and the dignity of the value of our people. So that it's not about whether we're saving money and whether we're minimizing resources, but are we really meeting the needs of our people? And our healing-informed approach is particularly different because it moves it from a transactional to relational approach. Oftentimes we think with our minds, but we don't think with our hearts. And I think the power is really in the connection of the two. And it's an opportunity to really acknowledge the historical trauma in our communities and what they have faced, and using it as a strength to transform our communities. Because if we don't get to the point where we can actually acknowledge that something has happened historically, there's no way we can move from it and heal from it. And it's really about investing time and building connections with folks, really having an emphasis on the communication and the connection between one another and across sectors. And we do a lot of emphasis on capacity building, and not because residents don't know what it is. Residents have this lived experience. They know what these problems are, they live it every day, but our job is about naming it, creating that consciousness so that they can talk to their system leaders. Times I have it happen where, resident leaders are, why should I have to change the way I talk about my reality with system leaders? And the thing is, it creates a shared language so that they can understand you. It's sad to say that you have to get to that point. And we offer tangible opportunities for them to move to action. So we name it, we create that critical consciousness, and then it's, this is how you can change it. And really emphasizing the value of building relationships through government. There's a lot of distrust with government, and this is the opportunity for folks to see the value in doing that. And we have started to do that in Salinas. We're building the power of and capacity of residents to analyze these structural problems and realize that they have the right to push our system leaders to change their policies that inherently are affecting all areas of our lives and the thing we have little control over at this time, which is our health. And so we do a lot of trainings on the ground on what is racial equity, what are some of these historical traumas, and allow a space for them to connect with each other, to build that power, feel that strength, and really exercise that emotional fortitude to be able to deal with it and move to action. As we are developing creative and innovative strategies to build resident power, we know that the narrative being shared is important, as was mentioned. Our narrative can be a powerful tool to advance our work. There's currently a false narrative of Salinas, and particularly youth. We have to shift the way our narrative, our lived experience is told so that it can be used as a vehicle to change the way people and systems operate. It is, to no surprise, those of you that don't know Salinas, that we are known, the common narrative that is shared is around violence, particularly gang violence. We have been named several times the #1 youth murder capital of the nation. And you'll rarely hear me say something like this because I'm intentional in the way that I talk about my community. But for the purposes of this, and for those of you that haven't had the misfortune of hearing it shared that way, I'm mentioning it because gang violence needs to be talked about as a symptom in order to identify the real problem and address it. There needs to be a structural analysis developed that demonstrates that violence is a symptom versus the problem. And so it's shifting the way that we talk about our community, really focusing on the strengths of our community, the resiliency, the hardworking people that live in Salinas, and seeing youth as assets and leaders versus these liabilities as they're commonly shared in mainstream media, and even among a lot of youth-serving organizations in Salinas. We need to move from solely blaming the resident for their negative outcomes and shifting the responsibility to local government. They have the responsibility to keep their end of the bargain and care for their residents. And so we need to uphold that responsibility because it forces residents to make choices that affect their well-being and their overall health. And it's about what Tony mentioned earlier about shifting from a lack of belonging to the community and creating inclusivity. Currently, you are part of the community unless you're young, unless you're undocumented, unless you're a criminal, and among many other reasons. And so I'd like to tell you about a time I was first bothered by this concept of centering the problems of the community around gang violence. I had gone to a community meeting of collaborative made up of service-based organizations, CBOs, and most importantly, law enforcement and elected officials and staff. Their presentation was on their violence prevention strategy. And I was automatically turned off because there was an introductory slide with a big red circle that said, "The problem, gang violence." And I was irritated because, to me, I said, this is a symptom. And it's really a series of root causes, including lack of affordable housing, low-wage jobs. I mean, we're talking about an $8 to $10 billion ag industry, but that has low-paying jobs. A lack of educational and vocational opportunities, a lack of open green space, and the list goes on. So what I did was invite this presenter, who happened to work at the health department, into the BHC world. And I talk about it as a BHC world because it is drastically different from the frame that most people work under. And so because I say this now because after spending so much time with BHC partners, she is now that person in the room keeping her colleagues and peers accountable to take a strength-based approach. when talking about our community. And she's pushing them to look for solutions that address the root causes of these social problems that impact our health. And that would not have happened if I had not opened my arms after my irritation was gone, opened my arms and said, you need to hang out with us. You need to hear what we need to say. The power in owning the narrative is necessary in order to move beyond an us versus them mentality with government. We cannot do this alone. And it requires the collaboration across sectors, and more often than not, reaching out to entities that are not traditionally seen as allies or partners. So our work in Salinas has completely changed the way government interacts with community-based organizations and its residents. 2014 was a tough year for the nation, and specifically for our community as well. After 4 fatal police officer-involved shootings, we used this moment as a catalyst to demand changes in the way that government functions. Through this tragedy, we were able to get buy-in from local government that more was needed to change their relationship and trust with community, that this was beyond just the police department, and was deeply rooted within their system. We hosted a healing-informed governing for racial equity training with city staff and community leaders, and this allowed us to name those inequities across the community and afforded us the opportunity to build a different type of relationship. It really allowed us to build the capacity of system leaders to change the way that they look at problems and how they are finding the solutions. It allowed us an opportunity to create that trust and to hold each other accountable and to really strip each other from our titles and be vulnerable and see our true selves. And what Tony talked about earlier about humanizing each other. System leaders often do not humanize residents, and they see them as numbers, they see them as data. And it also allowed the opportunity for residents themselves also to see that these folks that are making those decisions are also human. And so after achieving a shared language and understanding the complexities of structural racism, as well as agreeing that changing one person or one department was not going to make a difference in the culture of an organization, their practices, and their policies. So we agreed to look at the system as a whole. And the way that we look at the system is important because we need to look at it through all of our lenses, right? Thinking about race, thinking about gender, sexual orientation, ethnicity. However, as community leaders, we need to remember who holds the power. And there's no power balance. So we need to continue organizing to keep systems accountable and uphold their community, their commitment that they have to the public. Because of our strengthened relationship, we are currently doing work around transforming their community engagement. And so we're building the capacity of system leaders through a community engagement spectrum and having that shared language on what we define as community engagement and pushing them, to a higher level of community engagement that is about empowering, not just checking the box that they're connecting in some way, shape, or form with community. And to aligning that across the entire community engagement processes for the city, not just this one plan, like let me give you this one time where you can use it. And really calling out the distinction between othering and belonging and realizing that we're one whole community. So there are some partners in Salinas that are working with the county health department and local government to improve the built environment for youth in our community. This would not have happened had BHC not opened the door for this type of collaboration. And a person who works for the health department, and yes, it's the same person from earlier, connected with the city's Department of Public Works after hearing a local advocacy group of skaters at a city council meeting asking for basic amenities, bathroom, water fountain, lights, in a park on the east side. Because of their collaboration efforts, they had started to slowly invest more in parks that have the most need, not the ones that, quite frankly, the white people on the south side were asking for. It is less about who screams the loudest and more about who could or should benefit more, who has been left out of the equation historically. And this not only reframes the negative narrative of youth in Salinas as leaders of their community, but addresses the structural problems within the city that have prevented them from investing appropriately by using that racial equity analysis and ultimately improving the quality of life of residents. I think all of you, if not most of you, know about the upstream approach to health and have heard the story often shared to emphasize the value of focusing on prevention. The story of a man fishing near a river and rescuing people that were coming down the river and are drowning, but realizing quickly that he did not have enough strength and capacity to save everyone, and goes upstream to discover that the people are falling in the river because a bridge is broken. Our community has evolved in this thinking and taken the upstream approach up a notch. And we thought we only needed to fix the bridge, right? But now we're thinking about who's building the bridge? Where is the bridge being built? How is the bridge being built? Who has access to the bridge? And beyond that, evaluating whether or not the bridge has actually saved people and improved their health outcomes. As you leave today, and as you're in your conversations, I'd like you to think about a policy and systems change approach using a healing and racial equity lens. We need the healing to be embedded in our work because we need to stop focusing on just thinking about the mind and connecting the mind with the heart. That those being impacted need to be at decision-making tables, and that we need to explore creative ways to be transparent and inclusive in decision-making processes. And keeping in mind that the normalization about talking about race, particularly the history of systemic oppression in this country, you know, slavery, the near decimation of Native Americans, the history of structural racism in this country has affected the health of people. Normalization and understanding in which racism is embedded structurally and why a systemic racial equity approach is essential. The more we talk about it, the less anxiety we have about it. And this can help in developing that structural analysis and scale up the efforts of advocates to build power and change the narrative and collaborate across sectors. The goal is to liberate us from this legacy of racism and oppression, and to give the opportunity for people to actually have a chance to be healthier, because as it stands now, the odds are not in their favor. And in order to do this, we need to continue organizing and building power to keep our systems accountable to combating structural racism. Thank you.
I think you get a little glimpse of the kind of partners that we have doing this work. I mean, that was fantastic. Thank you so much. And we're going to delve into that a little bit. But first, we're going to hear from Kanwar Paul, who is the co-founder of the Rise Center and the Community Health Director. And again, her bio is also in your packet.